Hello, my name is Dr. Sean McMillan, and today we'll be discussing the use of a type 1 collagen matrix for augmentation of hamstring ACL reconstructions. The type 1 collagen wrap being described is a resorbable type 1 collagen matrix that provides a non-constricting encasement for the hamstring tendons. Unique to its properties is that it is able to bind to whatever fluid substance is used to rehydrate it. It is self-curling in nature and non-friable, but it is important to remember that it does not provide tensile strength to the overall ACL graft. Pictured on the left is a type 1 collagen matrix coming pre-curled. It can be unfurled, however, into a sheet which is easily cut to fit the graft in hand. The method of rehydration is per the surgeon preference. Surgeons have opted to use in the past saline, PRP, stem cells, and bone marrow aspirate when rehydrating the collagen matrix. Potential benefits for using a type 1 collagen matrix for ACL graft reconstruction include increasing the healing potential within the femoral and tibial tunnels. Previously, the use of biologic agents for ACL graft reconstruction has been met with mixed reviews. Pitfalls, however, previous to this have included the inability to maintain the appropriate location of the biologic agent within the femoral and tibial tunnel after being placed. By using the collagen matrix as a delivery system, we potentially can eliminate this problem. Another benefit includes increasing the footprint synovialization by again having the biologic agent at the apex of the tibial and femoral tunnels. For grafts that are smaller than 8 millimeters, we can potentially increase the graft diameter as well. The ultimate goal when using a biologic agent for soft tissue graft fixation is to decrease the soft tissue tunnel time incorporation, thereby allowing us to get to an accelerated rehab protocol seen with bone tendon bone graft reconstructions. My indications for using a collagen matrix for augmentation of ACL reconstructions include soft tissue allograft reconstructions, revision surgeries, patients that are smokers, immunocompromised patients, and for grafts that are less than 8 millimeters in diameter. The preparation of the graft is as follows. In a sterile pack, the collagen matrix is placed on the back table. The reconstituting agent is selected by the surgeon and placed into the tube for rehydration. I typically maintain 3 minutes of rehydration before removing it. The collagen matrix is then measured to the graft specifications for length and whip stitched into the ACL graft. When placing the matrix onto the ACL graft, it is important to maximize the coverage. Using the rule of thumb of 30 millimeters of graft within the intra-articular portion of the joint, we aim to place 15 millimeters of type 1 collagen matrix within the femoral side and 15 millimeters of type 1 collagen matrix within the tibial side of the tunnels. This allows for optimal fixation at the apex of both tunnels. The video depicted here is an ACL hamstring allograft reconstruction with the type 1 collagen matrix wrapping. As it's being pulled into the joint, it's important to recognize that the PRP, which was used to reconstitute the graft, has maintained its position within the collagen matrix. The 15 millimeters is placed into the tibial and the femoral tunnel respectively. We then secure them into place appropriately, period. In an effort to protect the collagen matrix, we select to use a femoral button as opposed to a screw for our fixation. Once we have secured the tibial side, we drain the knee and take our remaining PRP to inject the tibial and the femoral tunnel respectively. We then take any remaining PRP and pierce into the collagen matrix and fill the graft with the remaining PRP. This allows for biologic agent within the inner and outer portion of our collagen matrix. Some pearls when considering the use of a type 1 collagen matrix for ACL graft augmentation. First, you should oversize your tibial tunnel by 0.5 to 1 millimeter over the measured size of your ACL hamstring graft. This allows for entrance of the graft into the tunnels without the risk of stripping it off of your graft. You also want to ensure that there's equal portions of your collagen matrix within the tibial and the femoral tunnels. As such, measure your graft appropriately and place the type 1 collagen matrix so that way there's equal amounts within the tibial and femoral side when the graft is secure. On the femoral side, I recommend using button fixation as opposed to a screw fixation. This allows for circumferential placement of the type 1 collagen matrix within the tunnel. After fixation of the femoral and tibial side, drain the knee and use an ATH spinal needle to inject the remaining PRP into the femoral tunnel, the tibial tunnel, and then inside the collagen matrix with the hamstring graft. I recommend avoidance of use of Marcaine post-surgery, as well as avoidance of use of Toradol. Thank you for your time and attention.